Chronic Obstructive Pulmonary Disease, or COPD, is a progressive group of lung diseases that makes breathing a daily challenge for millions of people worldwide. Affecting over 3 million people globally, COPD has become the third leading cause of death. Whether it's chronic bronchitis, emphysema, or a combination of asthma and COPD, these diseases inflicted significant damages to the lungs, leading to frequent infection and decreased oxygen level. This was experienced by the famous singer Amy Winehouse, an iconic voice that is silenced far too soon. The future of COPD treatment lies in innovation, personalized medicine, stem cell therapy, and new drug delivery systems like nanoparticle inhalers that are pushing the boundary of what's possible.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrow Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities. Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week Open Mic webinar. For this week, our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, will be presenting this topic, and I'm going to share with you a recap of what Dr. Van discussed. First, Dr. Van went over the causes of COPD, with primary cause or the main cause due to irritant relating from tobacco or smoking. But aside from smoking, there are also other causes, and they related to genetic cause, environmental cause, also respiratory infection like long COVID.
And of course, if you have recurrent respiratory infection, that also can cause a lung to be damaged and result in respiratory difficulty.
Dr. Van then discussed the different types of COPD with chronic bronchitis, with emphysema, and also long COVID.
And then, of course, asthma and overlapping with chronic obstructive pulmonary disease.
Dr. Van then discussed its effect on the body, like shortness of breath, chronic cough, frequent respiratory infection, decreased airflow, decreased oxygen level, increased CO2 level.
As you see, these conditions also result in lung tissue that we discussed, but also result in increased mucus production as in chronic bronchitis.
Dr. Van discussed about the different signs of COPD, like shortness of breath, increasing lung volume, like the patient would have a barrel-looking chest, and also prolonged expiration as the patient tries to expire or push off the air out. Dr. Van discussed the different treatment option and outcome, and the key treatment or to halt this disease is to stop smoking. So stop smoking, also the use of bronchodilators to dilate those small airways in the lungs, steroid to suppress the inflammation of the lungs, also pulmonary rehabilitation for the lung itself. The common treatment used for COPD, as Dr. Van discussed, are the bronchodilators like albuterol, salmeterol. Also, as you can appreciate, those drugs dilate or expand the airways in the lung, allowing the patient to breathe better. And the inhaled corticosteroid will suppress the inflammation, thus reducing damage to the lung. Dr. Van mentioned or went over the new medication like LAMA, corticosteroid inhalers, also triple therapy with LAMA, also inhaled corticosteroid. Other treatment for COPD that include in this part of new trend, it would be personalized medicine, doing genomic profiling of the patient to help us detect or diagnose the disease faster. Stem cell treatment, also advanced delivery device like delivery with nanoparticle to improve the delivery of drugs to the lungs. In terms of biotech company innovation, there are a couple of companies that we discussed today, and these are companies that make the biologic or drug to suppress the inflammatory process. One of the drug was recently FDA approved back in May, and the company is continuing to expand its label expansion. Other company that we discussed during this presentation also present a potentially lucrative investment for us as well. Make sure you watch this video and then studying the underlying science and medicine, and then look for a company that make biologic to suppress the inflammatory process process inflammatory pathway, or company that can improve the quality of life for the patient.
You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.